Step 1. Ask. Identify the issues.
Good morning, Linda. What brings you in today?
Well, I've been getting headaches, and I feel extra tired after work more than I used to. So I wanted to come in and see if there was anything going on.
After you ask more about the headaches and fatigue, review her lab results and rule out other common potential causes of fatigue. You begin to think Linda's symptoms may be caused by hypoglycemia, so you ask about her diabetes.
And how do you feel you've been doing with your insulin and your other diabetic medicines?
Sometimes on Saturdays I forget my pills, and if I skip a meal, I also skip my insulin. But I'm usually pretty good about it.
And what about your blood sugar? How do you feel you're doing with that?
I think I've been doing a great job of keeping my blood sugar down. And, well, sometimes it gets so low and I kind of get shaky, and especially if I've missed a meal. But when that happens, I just eat some candy and I get back up.
Besides getting shaky sometimes, how do you know you're keeping your blood sugar down?
Well, I check it a couple of times a day, like the nurse taught me to.
Huh. And what are your fingerstick blood sugar values when you get headaches or feel extra tired?
I check it sometimes when I feel tired, and it's usually 60 or 55.
Why don't we take a look at your fingerstick values and your hemoglobin A1C? I see that your blood test shows your A1C is now 6.5.
That's good, right? You said to not keep it higher than 7.
That is what we discussed, but you know, our understanding of diabetes is always changing. Recent studies now show that tight control 7 is too low for some people. So what I want to do is work with you to find out what number is right for you.
You give Linda an easy-to-read handout on hypoglycemia that she can take home. You also offer to send her a text with a link to the handout online, if she prefers. Step 2. Prioritize. Focus on the patient's needs. You're beginning to think that Linda may benefit from a higher A1C target, but you want to learn more about her needs and goals before making a treatment decision.
What's most important to you to keep your diabetes from causing you other problems?
I'm scared to get other problems from my diabetes, and because I live alone, well, I'm afraid something serious could happen to me.
Sounds like you would like to have fewer headaches. You would like to take less medicine, and you would like to feel safe. It is totally understandable that you are worried about your diabetes causing you other problems. But on the other hand, if your blood sugar gets very low, that can be risky too.
Step 3. Assess. Identify barriers to shared decision-making. Normally, you would assess a patient's cognitive ability related to making treatment decisions. But you know Linda and have seen her recently. However, you do need to assess her beliefs and values and any knowledge gaps.
I think having a higher A1C will make you feel better and less tired. And we can still work towards lowering the chances that you'll have other problems from your diabetes. So, are you willing to consider a higher A1C?
I think so, but my daughter also has diabetes, and this doctor that she sees said it's really important to keep her A1C below 7, and well, that's what I've been told in the past.
That's a good point. But I think it's important to recognize that when you're managing diabetes, it's not one size fits all. And that we're going to work hard to find the number that's right for you, and that might be different from your daughter's.
You talk further with Linda to confirm that she understands the process of determining A1C goals.